Good evening everyone, I'm Dr. Nandita TRIVEDI and my presentation is on epidemiological profile and serum vitamin A levels in pediatric infectious keratitis in North India. Financial disclosure, nil. Corneal ulceration refers to defect of corneal epithelium with inflammation of underlying corneal stroma. Problems faced in the pediatric age group include difficulties in clinical examination, microbiological sample collection and maintaining adequate levels of topical medication. There is paucity of literature of epidemiological profile done for pediatric infectious keratitis in a prospective manner and its correlation with serum vitamin A levels. The objectives of our study were to identify the etiological agents, to identify the ocular and systemic risk factors, and to report the outcome of pediatric infectious keratitis. 45 cases in the age group 1 month to 18 years, clinically diagnosed as bacterial and or fungal infectious keratitis with follow-up till complete healing were included in the study. Patients diagnosed as viral keratitis, neurotrophic keratitis, incomplete follow-up and neonates were excluded. An equal number of age and gender matched children undergoing surgery in our setup for non-ocular pathology were recruited as controls for serum vitamin A analysis. Detailed history was taken from the parents or the guardians with specific noting of the risk factors, following which general physical examination was done on the first visit and anthropometric measures were noted, and complete ophthalmological assessment including vision, slit lamp examination and fundus examination wherever possible. Following this, corneal scraping was done and serum vitamin A analysis was done by HPLC method. An initial treatment was started based on the clinical evaluation and microbiological smear examination, and it was modified later based on the culture sensitivity report. The mean age reported was 4 plus minus 5.4 years. 82% had unilateral eye involvement. 88.9% patients had prior topical management before they presented to us, and 64.4% cases were from rural background. The most common predisposing factors were trauma to the eye in 40% cases and systemic illnesses in another 40% cases. 40% cases were exclusively breastfed in the initial 6 months of life. And odds of non-exclusive breastfeeding was 25 times higher in less than 5 years age group compared to more than 5 years age group, and the p-value was significant. Mean serum vitamin A analysis. Cases had low vitamin A levels compared to the controls and the p-value was significant, and the risk ratio is significant in less than 6 months age group. Most common etiological agents isolated were Staphylococcus aureus followed by Streptococcus pneumoniae, and the average duration of healing was noted to be 22.4 plus minus 5 days. The most common outcome reported was corneal opacity. Other outcomes included staphyloma, phthisis and therapeutic keratoplasty, which was done in 10% cases, and wasting was seen in 48.9% cases, out of which 68.2% cases had wasting, which was in less than 6 months age group. Discussion. So in our study, 44.4% cases are younger than 6 months. This result is similar to previous studies which have been done in India, and this is in contrast to studies which have been done in the developed countries where the mean age is slightly higher. For predisposing factors, trauma is most often associated in developing countries as a risk factor. In our study, the use of contact lens was a risk factor in 1.9% cases. This is in contrast to what has been reported in developed countries where the use of contact lens is slightly higher. And for systemic illnesses, repeated episodes of diarrhea leads to increased risk of xerophthalmia due to vitamin A depletion. For feeding habits, 80% cases were fed cow milk during the initial 6 months of life, and we need to note that 55.56% cases were less than 1 year age in our study. Vitamin A content of human milk is also affected by the maternal nutrition during pregnancy and lactation. For vitamin A analysis, age stratified normative data for serum vitamin A levels in children for Indian population is not available. Hence, controls were taken in this study. And breast milk is the only source of vitamin A in exclusively breastfed infants up to 6 months of age. For our study, the etiological agent most commonly isolated was Staphylococcus followed by Streptococcus pneumoniae. Pseudomonas was seen in 9.4% cases. This is in contrast to what has been reported in developed countries because the use of contact lens as routine for children in our setup is lower. Fungi was reported in 13.2% cases. Varied results have been reported in South India, which is like roughly 1/3 of the cases. This is because hot and windy climate makes fungal keratitis more frequent in tropical areas. So the conclusion, the most common predisposing factors for pediatric infectious keratitis were trauma and systemic illness. Staphylococcus aureus and Streptococcus pneumoniae were the most common etiological agents isolated, and the risk of vitamin deficiency among cases less than 6 months of age group is 8 times higher than control of the same age. Summary, the risk of vitamin A deficiency is decreasing with age. Implications of a result suggest direct correlation of malnutrition and subnormal vitamin A levels in pediatric infectious keratitis. Policy change with respect to vitamin A supplementation early may be considered to avoid pediatric corneal blindness due to a nutritional cause. And strategies are needed to focus on vitamin A supplementation to infants and mothers within 6 weeks of delivery. Thank you.
Nice presentation. Did you do a subgroup analysis to see whether the infants behave very differently from, because you have kids even older than 5 years, right?
Yes, sir.
Maybe you could have stuck to very young kids for this particular study. That it would have given more meaning, I feel. Now, it's
confounding variables that come in.
Yes.
Because older kids are more exposed to going out, trauma.
maybe you can again eliminate the smaller age group, the older children, and make this study a little cleaner. That's what I feel.
Okay, sir. So that would require a longer period of study. But yes, sir.
The numbers, the end value would go down.
Yes, sir.
It will be more targeted and specific to a particular age group, which is what you're trying to evaluate.
Yes, sir.
Because the nature of the etiology may be very different in a 6-month-old
Yes,
and
sir.
a 6-year-old.
Yes, sir, absolutely.
Any attempt to look at the adnexa in these children, the lacrimal system and the conjunctiva?
So for very young children, like less than 6 months children, it is very, very difficult to assess. We have assessed those who are older, but for very young children, we haven't been able to assess them.
Associated congenital adnexitis.
No, sir, not that we've noted. So I documented during examination, but there was no specific finding which had to be correlated. Yes, sir. Thank you, sir.